At Good Days, we strive to reduce preventable deaths and improve quality of life for everyone in need of access to health care. We are dedicated to creating a more equitable and accessible healthcare system. The need for change is urgent, as preventable chronic illnesses continue to negatively impact life expectancy across the country.
Good Days proactively leads a nationwide initiative aimed at promoting awareness for chronic disease prevention and access to care. Chronic Disease Day was created and is observed annually on July 10th to raise awareness that 7 out of the top 10 causes of death in the United States stem from chronic illnesses, the majority of these being preventable. Representatives of leading public and private healthcare groups, including from the Centers for Disease Control and Prevention, National Institutes of Health, Morehouse School of Medicine, and more have partnered with us in our efforts to reduce chronic illness and build healthier communities. Life expectancy in America has begun to drop behind peer nations because of a surge in preventable chronic illness. At the same time, many individuals with unpreventable conditions lack access to life-saving medication and treatments. The urgency for change has never been more apparent.
Good Days is very focused on preventative care in this country. Chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. They are also leading drivers of the nation's $4.5 trillion in annual healthcare costs. Many preventable chronic diseases are caused by a short list of risk behaviors: smoking, poor nutrition, physical inactivity, and excessive alcohol use. We are working to raise awareness, develop programs, and advocate for affordable treatments that will improve the outcomes associated with these risk factors. Obesity is the #1 driver and the leading cause of preventable disease and death in this country. Obesity is not a cosmetic concern, it's a medical problem that increases the risks of many other diseases and health problems, including heart disease, type 2 diabetes, high blood pressure, high cholesterol, liver disease, sleep apnea, and many cancers. Despite growing recognition of the problem, the obesity epidemic continues in the U.S. The time to act is now, and prevention is key to the slowing and ending of this epidemic. Good Days has committed this to their mission of fighting chronic disease. While our advocacy and assistance programs are national in scope, we also implement programs that have very targeted impacts. One good example is a project in the Rio Grande Valley located in South Texas. The University of Texas, Rio Grande Valley, and the South Texas Cancer Research Center have begun the Cervical Cancer Prevention Action Network, CCPAN, an initiative spearheaded with the help of Good Days.
The Rio Grande Valley encompasses a 4-county area along the border of Texas and Mexico. We are one of the youngest, fastest growing communities in the country, and it's a really familial-based community. There is a lot of multi-generational families living in one home.
Women are the engine of any community, but believe me or not, they are the most ignored one because they are so exhausted all the time in their family, in their other duties, and they just ignore their own health.
We are a medically underserved community, and the role that prevention and health education plays is extremely important to the health outcomes of our community members.
This population suffers a lot from cancer disparities. Certain cancer in the valley are highest in the nation, and you can say highest in the world as well. Number 1, liver cancer, gallbladder cancer, and cervical cancer. And I was really surprised in some of the communities that HPV vaccination rate is less than 2%, which was really striking to me. And that was the reason UTRGV come up with the idea to establish a cancer center and establish a department which is focused primarily on cancer and cancer research. We know about HPV, we know about it is involved in cervical cancer. Now we have a vaccine, but problem is awareness. Our population is not very well aware of it.
One of the things that comes with that familial community type is a reliance on information from family and friends in the church as opposed to healthcare providers.
And one first idea came to my mind, like, okay, let's develop a cervical cancer action network plan.
Dr. Chauhan came to our department with his project idea and his research interest.
And the vision was very simple, like we are going to educate the community, we are just going to develop some unique educational module, we are just going to the high schools, we are going to promote HPV vaccination, we are going to promote HPV diagnosis. So that was very clear vision, and if we do all these things right, then it will reduce cervical cancer from the community, which we see very high here in this valley.
We reached out to My Good Days, knowing that they had a strong presence and support of cervical cancer and research endeavors.
This program fits perfectly with our overall mission at Good Days. Our goal is simple yet profound: to raise awareness, promote early detection, and reduce cervical cancer incidence and mortality rates in the Rio Grande Valley. We saw this as a chance to not only impact the lives of these individuals, but to really improve an entire region of the country.
It's important to have relationships with funders such as Good Days. We rely on those partners to help us carry out our vision and give back to the community through those research endeavors and services.
To date, Good Days has provided more than 2 million grants and distributed over $3 billion in assistance, making a significant impact on countless lives across the nation.
I think we share the vision. So I'm really excited to work with Good Days Foundation.